Hi, I'm Lesley Batson. I'm the host at Black.Wealth.Empowerment. Thank you so much for watching this video. I wanted to do this short introduction. I had an opportunity to speak with a friend of mine, Dr. Cyd Charisse Williams. She practices functional medicine here in Orlando, Florida. She and I were talking in the past, before the whole coronavirus pandemic started. She and I were setting up a schedule to have a series of discussions to talk about health concerns in the Black community. Now, of course, we've seen over the past week, I'm recording this on April 14th, 2020, and we've seen over the past week that a significant number of the deaths from the coronavirus, whether it's in New York City, Chicago, New Orleans, they're saying Philadelphia could become a hotspot, Milwaukee. We've heard that a large percentage of the people dying from the virus are Black. So I hear a lot of discussion as people saying, why is this happening? We don't understand why is this happening. Um, I think we know that this is a larger thing, right? It's not just the single virus that is, having this detrimental effect in our community. We know it's a chain of events that's led to this, right? And specifically, I want to get to the health concerns, and so that's why I want to speak with Dr. Cyd Charisse. What you'll hear in our discussion, it was actually a good length discussion. I broke it out into two parts, two 20-minute segments. But what she's getting at is, here are some things that we can actually do. What for those who will continue to follow Black Wealth Empowerment, my goal with this is really to identify, what are the things that are hindering us. This initially started with identifying how can we close the wealth gap, right? The Black wealth gap is just getting bigger and bigger and bigger. And I don't think you can just address it with finances, right? There's a holistic approach we need to have. I've identified 7 categories, 7 areas that I think we need to address, things that we can actually take control and do. And one of them is health. So Dr. Cyd Charisse is going to speak to us about what she and I have talked about in the past. Is one of the key things that tends to be misunderstood and just missing from the health regimen of those of us in the Black community. So I hope you'll enjoy this discussion. This is part 1 with Dr. Cyd Charisse, and you can watch the second part at your leisure. Thank you so much. Hi, everybody. Lesley Batson here again for another great talk. Lesley Batson from Rebel Rock Wealth. I have a guest with me today, Dr. Cyd Charisse, and she's joining me today because I wanted to have this really important discussion. Let me provide a little context first. Most of you know me because of my wealth practice. I teach you different strategies as relates to money. And but I've also had this passion project. I call it the Black Wealth Empowerment initiative that I started. And the reason I started it is because I was very, let's just say I was prompted in January. I felt very compelled to start to provide some content, some good information that really spoke directly to Black people about this increasing the wealth gap that's happening here in the US and really across the world. And I felt like there's a lot of different initiatives that are taking place that are hoping to try to address this and tackle this, but there are solutions that are beyond our control. I wanted to hone in on different solutions that I felt like were within our control and things that we could tackle. And there were 7 areas that I believe that we should be addressing. They are savings, building, investing, retirement, business, health, and family. And today's topic, we're really going to focus on health because I believe that, your health is wealth. And so I wanted to have this discussion with, excuse me, Dr. Cyd Charisse. She's a good friend of mine and she's my doctor. She is she practices functional medicine. She was the team doctor for USA Track and Field. Let me just welcome her here now. Hi, Dr. Charisse.
Hi, Lesley. How are you?
Hi, I'm great. Thank you so much for joining me. I know this was kind of a last minute discussion. Um, Before we jump into the topic, I wanted to ask you, can you just define and clarify for our audience, what is functional medicine? How is it different from what most people are used to?
Yes, absolutely, Lesley. That's a very important question. So, functional medicine is getting to the root cause of a disease. So, I like to say the thing behind the thing behind the thing. Whereas in traditional medicine, you get a diagnosis, you have symptoms, they treat the symptoms, not really treating the underlying cause of disease. So with functional medicine, we want to get to the root of the disease, hopefully stop the progress of the disease, right? And
Mhm.
prevention is the number one treatment. So that's the goal of functional medicine.
Perfect. Thank you for clarifying that. So the reason I invited Dr. Cyd Charisse to speak with us today is because there's been this ongoing discussion for the last week or so, with us all really addressing the coronavirus. We've seen that in New York, in Detroit, in Chicago, in New Orleans, in a lot of major urban areas across the country, the death tolls have been significantly, or at least large numbers have been people from the Black community. And there's been a lot of discussion as to like, why is this happening? Why does this seem to be such a large number of Black patients that are having significant symptoms and even, eventually passing away? So I wanted to have this discussion with Dr. Cyd because this is something we actually talked about several weeks ago, just talking about chronic illnesses in our community in the first place. And we also understand that the Black community is not one dimensional. There are people who live in these concentrated urban areas. There are some of us who live beyond that. So not everybody necessarily has these same conditions, but we want to understand, why are we experiencing, or why is the Black community in these urban areas experiencing these types of chronic conditions? So let me just pass it to you, Dr. Cyd Charisse. What are your thoughts?
This is a very important discussion, Lesley. So I'm glad that you're taking the time to really dive in deep. So before we have the discussion, we also have to, from a medical standpoint, look at some very important background information. So the COVID virus itself is not causing the current death rate. And what I mean by that is that the fatalities in the African American community are not actually from the COVID virus, but it's actually from their immune system's response to COVID-19, to the virus.
Mhm.
So the virus itself is not the problem, it's our own body's immune response. And that is why you keep hearing about the chronic illnesses in the African American community are predisposing to increased infection rates and increased fatalities. And they're saying it for everyone, right? You've heard it over and over. If you have chronic illness, you're going to have a more difficult time with this virus if you contract the infection, right? So it's
Right.
very important to understand that it is the immune system's response to the virus that causes the problem. Now, if I have a chronic illness or a weak immune system, I am not going to be able to fight off the virus. So the body has a built-in system called the cytokine storm. And what the cytokine storm is a bunch of proteins that are inflammatory. They are released to help protect our body when a virus like the coronavirus invades, right? So that system, think of it as a thunderstorm with torrential rains that start flooding. If I have a great immune system, I'm not even going to notice that I have the virus. My body's going to fight it off. I'm not going to have any symptoms. If I have an adequate immune system, I may develop symptoms, but I recover. If I have a weak system or I have chronic illnesses, what's going to happen is that thunderstorm and those torrential rains are going to cause flooding, and I'm going to overwhelm my immune system. My respiratory system is overwhelmed, and now I have destroyed my lungs, and I no longer have the ability to transport oxygen, which we know is vital to life, to the rest of the tissues of my body, and then I have a fatality, right? So the important issue is that each person, it's their immune system, not the virus, that is causing the problem. And that is wonderful, because that means you have more control than you think. And
Right.
so the immune system is the problem. One, what controls the immune system? How do I fortify my immune system? Because prevention is the best treatment. So in regards to the African American community, if you look at the function and regulation of the immune system, and this is for everyone, but more so for the African American community, vitamin D controls inflammation. Vitamin D controls the immune response in the body and the immune response in our lungs. So in addition, vitamin D also controls blood sugar. Vitamin D, every cell in your body has a receptor or an attachment site for vitamin D. So if you start looking deeper and say, okay, the African American community has more chronic illness, more chronic disease, and the literature actually states that vitamin D can improve chronic illness and disease. And
Mm.
so if vitamin D is so important in the inflammatory process, then when we're talking about COVID-19 and fatalities in the African American community, we have to look deeper and say, wow, we have those fatalities. What is it about our system, that our people, that we have the chronic illnesses, and what is it about that allows this virus to take over and cause the sickness and fatalities? Does that make
Mhm.
sense?
Perfect
So
sense. Yeah.
yeah, so I think we have to look at the vitamin D level. And if vitamin D is that important in the immune process, then we have to say, okay, as a community, how are we regarding our vitamin D levels? Now, let's see, anytime that you eat, every time you eat, the sole reason you eat is to nourish your body, to provide vitamins, nutrients, minerals, so that your body can function properly. And that is what builds a strong immune system. And so therefore I have control because my immune system is based on my my body's nutritional status. In addition, if I have chronic illnesses, I do not have a great immune system. So you see where those two come together and can increase and cause fatalities with COVID-19.
Right.
So if you look in depth at the African American community, natural vitamin D from the sun is wonderful because our bodies can create vitamin D from sunlight. However, if I have darker skin, when that sunlight hits my skin, I'm not going to produce as much vitamin D as someone who has a lighter skin tone. So therefore, if my diet is deficient in vitamin D, and there are a lot of other vitamins and nutrients as we've discussed that are very important, if I am deficient in my diet, therefore, if I'm outside, I'm not going to get the passive natural vitamin D that someone with lighter skin may have. And so it's important to know that, wow, we have a list of chronic diseases that can be affected by vitamin D, and which puts us at risk for a decreased immune system strength. And therefore, it's a less opportunity to protect yourself from infections. And then I have darker skin, which, hey, our skin is great for preventing cancer, right? So we're less likely to have skin cancer because of the darkness of our skin. However, the melanin is going to respond to the sun, and the melanin's not going to allow as much light in to produce the vitamin D through the skin, which then goes to your liver. So I think that's an important concept of looking deeper into issues from a medical perspective and from the perspective of, hey, what can I do to help protect myself, right? I think a
Right.
lot of people are in fear of their life and health from COVID-19, when in actuality, you have more control than you think because, first of all, if you wash your hands, you're not going to transmit that infection through your mouth, nose, or eyes, right? Your mama taught you, wash your hands before you eat, right? We
Right.
have to remember that virus is spread in urine and stool, mainly stool, but any virus or anything that you have is shed in your stool or urine. So you have to wash your hands after going to the bathroom so you can control that. So that's controlling transmission of the disease. And hey, you have to remember, they're talking a lot about a COVID vaccine, right? So everyone's saying this will be great. Well, we have a flu vaccine, right? The COVID virus, flu virus, the common cold are all spread the same way. So even if there is a COVID vaccine, you cannot become complacent and say, oh, I am protected, because there are other invisible germs out there that are going to act just like COVID.
Hmm.
So we have to stay and stick with the basics of prevention is the best treatment, and that is washing your hands so that you do not transmit the disease. Does that make
And
sense?
yes, absolutely. And covering your mouth, sneezing and coughing into your elbow, those kinds of things. Yeah. Because Yeah. But I think you hit on
Absolutely.
something really important that I want to make sure I repeat, because I think so many of us have heard, just go get some sun to get some vitamin D. I know that every year I go, I have my annual exam before I've been seeing you, but I get my annual exam and I get straight A's, A pluses everywhere, except I'm always extremely low in vitamin D. And I do have asthma. I have this cough, this little cough that I know annoys everybody around me. It doesn't go away. I always feel like I have this some inflammation in my body somewhere because it causes this cough and this stuffy, like sinusy, nasally sound. And it's one of the things that you and I talked about was, the first thing you asked me was, how is your vitamin D? And I was like, why is she asking me about my vitamin D? How does she know this? But it was one of the first things that you thought of was, well, if your system is, functioning a certain way or not functioning a certain way, you knew immediately to say, I wonder what her vitamin D levels are. And I think that's one of those things where within our community, we just don't know those things. We're thinking if we get some sun, that should be good, but it's not necessarily all that we need to be doing. There's definitely other ways to get our vitamin D. So can you talk about one? So you had also mentioned to me, it's not enough to just take vitamin D. You need to take it with, is it K3?
K2, vitamin
K3.
D3 with K2.
Okay, so
So
I'll let you explain that.
I want to respond, like you said, with asthma, right? That's on our chronic disease, excuse me, chronic disease list, right?
Right,
High blood pressure, diabetes, asthma, cardiovascular disease, colon cancer. There's so many different things, right?
right,
So asthma is also literature improved with vitamin D levels, right? Because vitamin D controls the immune function of the respiratory system, which is inflammation of the respiratory system. So you see that we've got all the categories in which vitamin D is involved in
right.
our chronic illness list, right?
Yeah,
So when you improve your nutritional status by replacing a necessary nutrient, that's going to be the best thing for your body, right? Your brain controls everything. Your body knows what to do. We can either impair it or we can enhance it, right? And so when you talked about vitamin D3 with K2, that's really important because the issue is that our foods are not supplying enough nutrients for us, right? Processed foods, fried foods, foods high in sugar do not have the nutrition that our bodies need to function. And so that's part of the total healthcare problem in the United States. And so if our gut is healthy, which your immune system is produced in your gut, by the way, if my immune system and my gut are healthy, my gut is going to produce that K2, and K2 tells your brain, hey, that calcium that's mobilized by vitamin D, I need you to put that in the bones and in the teeth so that it's not floating around mixing with sugars and clogging the arteries, right? So that's why we say vitamin D3 with K2, so that if you are not having the proper nutrition in your body to function, you're not going to have enough K2 to say, hey, let's put the calcium where we need it the most in the bones and the teeth. And vitamin D we listed also controls immune function, respiratory function, every cell in your body, sugar metabolism, but it's also muscle, ligament, and tendon healing and growth in children, right? So
yeah.
vitamin D does everything. And I think that that's one of the reasons why we have to look at it as a contributing factor to illness in the African American community. So,
Absolutely. And mhm.
yeah, and I'm sorry, go ahead.
Well, no, I was gonna just agree with that. If we look at in some of these, urban areas, if there are food deserts, there's not like a proper grocery store, so they don't have access to, foods with nutrients, right? They're going to the corner store, and what's going to be there? Processed packaged foods or processed packaged meats. And if that's the diet they've grown up eating and that they're accustomed to, just because they get older and they learn that they should be eating something else, it doesn't mean that their palate is going to all of a sudden want to start consuming that. And that's, I think, one of those cyclical generational type issues that causes these chronic conditions.
You are absolutely right. And the other part of that is, I love when you said the palate is just, it loves the sugar, right? So that's why
Yeah,
I love the foods, there's sugar in ketchup, right? So a lot of
right.
them have sugar in it so that you will crave that. They actually dip the bacon in sugar. Why do you need sugar and bacon, right? So because they know that that little taste of sweetness is going to hook you, right?
Right. Yeah.
One of the other issues related to the African American community, socioeconomically, is that processed foods are cheap,
Right.
right? They're cheap. So I can eat lots of them. It doesn't cost me a lot of money, but then again, I'm unhealthy. I
Right.
do not have proper nutrition, right? So I'm eating a bunch of food that does not have any nutrition, but a lot of wasted calories, right?
Right.
So I'm eating a lot of empty, not wasted, but empty calories. Our body is using these calories, unfortunately, but it's empty nutrition. We're not getting anything that the body needs to actually function, right? And to thrive.
Right.
And that's
Right.
where the problem comes in. And all of that is related to chronic illness. So we could go into depth as to for asthma, for heart disease. Do you know, I am not discounting COVID at all, but the numbers of people that die from other diseases chronically every year in this country, I like to call them things that are killing us slowly.
Mm.
Let's look at cardiovascular disease. It's very high in the African American population. Every 38 seconds, someone dies of a heart attack.
Mhm.
Every 38 seconds, right? That's
Yeah.
astronomical. And so COVID, yes, COVID is there. It's an acute illness that's scaring people, while heart disease is just hanging on, right? Number
Right.
one cause of death in America, right? Every 40 seconds, someone has a stroke. That's killing 140,000 people a year,
Wow.
right? And so you have to remember that, hey, even if I have diabetes in my family, if I don't eat sugar, I'm not going to develop diabetes. So
Right.
the
Right.
genetics, so a lot of times we are told in the African American community, you go to your doctor and you say, hey, I have why do I have high blood pressure? Why do I have diabetes? Oh, it's in your family. That's it, right? Genetics is about 8 to 10%, and the rest is the environment. It's called epigenetics. The environment is going to trigger this particular gene to turn on or turn off. So it's not just the genetics, it's the environment. So if everyone in my family has diabetes, type 2 diabetes, and I don't eat sugar, I'm not going to get diabetes, right?
Right.
So
Right.
there is a lot you can do with hypertension, heart disease. And so that's my point with the vitamin D, is that is one thing that we know is something that could be contributing. And then we have to say, okay, what else can we do? If that's going to boost my immune system, what else is going to boost my immune system, which gives me more power and more control? Because for the next invisible germ that's out there, I want my body to be ready, right? You'll notice
Right.
some people don't even know they have the disease. Some people succumb to the disease. And you
Right.
have to recognize that even if you are one of those people and you have a robust immune system and you do not react, you don't have any symptoms, your body fought it off, but you could still be shedding and spreading the virus because it's going to shed in your stool. So washing your hands helps to prevent spreading to other people. Even though you say, oh, I'm fine, I feel well, you still
Mhm.
have to be thinking about that so that you don't spread it to other people.
Thank you for watching part one of our discussion. I encourage you to listen to the next part two of how the COVID virus is affecting the Black community and what we can do to arm ourselves against it and other chronic illnesses. You can find this video on our YouTube channel and Instagram and Facebook at Black.Wealth.Empowerment. Thank you.